The anus is the exit of our bowel. The rectum is the storage area which holds our poo, and as our poo is ready to leave our body, it exits via the anus. The anus has got some muscles which stretch and squeeze to either hold our poo in, but also relax to allow us to empty our bowels. Some cancer treatments can affect our anus and our rectum, for example, radiotherapy and surgery. They can sometimes cause scars to happen, either within the anus or within the rectum itself. Those scars are exactly like as if you had a scar in a muscle on the outside of our bodies, and they can't quite stretch and squeeze exactly like they used to. So that can mean that our bowel or our anus doesn't work exactly like it used to, and we get a new normal. So we might find that we have thinner poos, we go a little bit more often because we can't hold quite so much, or sometimes that scarring can cause things to narrow so much that actually things get blocked and it's difficult to actually have a poo. When we think about those scars that can sometimes happen after cancer treatments, they can then affect our physical well-being. So what that might look like is when we come to clinics and have to be examined, an internal rectal examination can be uncomfortable, can be painful, or sometimes the scarring can mean that actually it can't happen. That scarring can also affect our sexual well-being, and so receiving anal sex can again be uncomfortable, can be painful, or some people can find that they can't receive anal sex, which might be a preference for you. To help reduce the scarring, you can undertake something called anal dilation therapy. All this does is opens and stretches the muscles of the anus, reducing that scarring happening over time. You can start by using fingers to open and stretch those muscles. Alternatively, you can look at using aids such as anal dilators or vaginal dilators to help open and stretch those muscles. It's important that whatever you use has something called a flared base, because our bowel is a vacuum and the flared base ensures that the dilator can be removed. With anal narrowing and scarring, some people do find that the skin around the anus can feel dry, itchy, or tighter. The use of moisturisers long term can help reduce this. When undertaking anal dilation therapy or receiving anal sex, it's important that you consider the use of anal lubricants. There are multiple different types of lubricants available on the market, and it's important that if you have any questions or concerns that you speak to somebody who will be able to provide help and support. Prior to using any anal dilation therapy, it's really important that you think about how your body can be really relaxed and thinking about making sure that your bowels are empty, and some people find that emptying your bladder is helpful as well. If you have a partner, communication with them is really important. Being open and honest about your worries, your concerns, will help alleviate some of the stresses you may be experiencing. You may find that actually it's best to try alone first to work out what does feel comfortable for you and be able to create different techniques that might support you further. Before even using the anal dilator, it's really important that you start by thinking about preparing your space. So making sure that you're as relaxed as you can be, making sure that the door's locked if that's appropriate for you, and also thinking, are you more comfortable in bed? Where's the best place for you to use this therapy? Once you're happy with that, you need to think about what position are you most comfortable in. Some people find that they're more comfortable using the dilators on their back, others on their side with a pillow between their knees. It's about finding what suits you. Then we always recommend that you make sure that you use lubricant. It's important that you use lubricant both on the dilator but also on the back passage or the anus itself. Then, when you're ready, slowly insert the dilator. Some people do find that when they first use it, the muscles at the anus itself can start to squeeze. That can be quite uncomfortable. We recommend that you take a moment, take a breath, pause, relax. When you then feel comfortable, insert the dilator as far as is comfortable for you. Everyone's different and unique, and it's about finding how far as comfortable is for you. It's really important that you try to take the moment to take some breaths, relax your pelvis as much as possible. We recommend that you try to hold the dilator in its position for around about 2 minutes. And then once those 2 minutes have passed, you can remove the dilator. There are lots of different sizes and different types of dilators available, and we always recommend that you start with the smallest dilator and work your way up to find what's most comfortable for you. When you think about anal dilation therapy, at the heart of it, it's stretching those muscles. So whilst anal dilation therapy might be uncomfortable, it shouldn't be painful. If it is painful, it's important to stop, take a minute, and come back to it another day. It's really important that we think about using our pelvic relaxation techniques to relax our muscles so that then actually when we do dilate, we're making sure that those muscles stretch and squeeze the best that they can. You may need to ask for help if you start to notice severe narrowing, a new onset of incontinence, itching of the anal skin, or bleeding from the back passage.